Hi everybody and welcome to our presentation. So today we'll be talking about navigating anxiety and how to stay healthy during this coronavirus. So we'll be starting by talking a little bit about what the coronavirus actually is, and then we'll be going a little bit into detail about what you could be eating or maybe some simple changes you could be making to make sure that you're doing the best you can to stay healthy during this time. So for those of you who don't know me, my name is Oonagh English and I am a nutritional therapist and meditation facilitator, and I run coaching programs out of my home office currently, thanks to Corona. And so if you want to find out more about me, I will be linking some things in the description box below. And now I'm going to hand you over to my lovely colleague Charlotte, who's going to kick off this presentation today.
Okay, hi everyone. So I'm Charlotte and I've been friends with Oonagh for quite a number of years. I'm doing a master's at the moment in immunology at King's College London, and so we thought it would be a good idea to link up together and do this webinar on anxiety and staying healthy during Corona. So unfortunately I'm in Wales at the moment and don't have very good Wi-Fi signal, so I'm just going to be saying which slide will be on to Oonagh, so hopefully you can see that. So Oonagh, could we go on to the second slide if we're not there already? And I'm just going to briefly say what we'll be covering in our webinar. So I'm going to be talking about the coronavirus, how it's diagnosed, how it infects cells, why it causes disease, what vaccines are being developed, and how you can protect yourself against the virus. So moving on to the third slide, I'm going to be talking about what the coronavirus actually is. So the coronaviruses are actually a family of viruses which encompass over 100 different viruses. So to just call it coronavirus is actually incorrect, because there are several different types of coronavirus. You may have already heard of SARS and MERS. So SARS was a disease caused by a coronavirus which emerged in 2002, and MERS is another disease which is also caused by a coronavirus which emerged in 2012. So COVID-19 is actually a virus, part of the coronavirus family, which has emerged at the end of December 2019. COVID-19 and SARS, which came out in 2012, are actually genetically quite similar, but the diseases are very different. SARS was much more deadly, but a lot less infectious than COVID-19. So I'm going to give you a bit of information about the outbreak. As I just said, it emerged in December 2019 in a local seafood market. And that was at the end of December, and by the 7th of January we had already sequenced the whole genome of the virus, which I think is pretty impressive. Within a few weeks we already know so much about this virus, and we found out that it's 95% identical to the bat coronavirus, which indicates that it may have come from a bat, and it's also 80% identical to the SARS virus. This is really crucial actually, because it's so similar to a previous virus that we have already encountered. It means that we already know a lot about the virus, and it means we're already on the right track for developing a vaccine. So coronaviruses are zoonotic viruses, which means they can jump from an animal species into a human. So it's thought that the coronavirus came from a bat and went into an intermediate host, such as a domestic animal, and then into humans. And we've also found out that the pangolin coronavirus is very similar to the one which is currently infecting humans. So this suggests that the virus may have jumped from a bat into a pangolin and then somehow got into the human food chain and has caused a viral pandemic within the human species, within human populations. So it may seem quite long-winded, but this is actually what's happened, and it happened previously. The SARS virus did the same thing. So the SARS actually jumped from a domesticated cat into humans. So this is not an uncommon thing. But the good news about all of this is, as I said, we know a lot about these viruses already. And so we're right on the track for creating a vaccine. Okay, so just moving on to slide 4. Just to confirm there, by domesticated cat, I meant it came from civet cats, which farmed wild animals. So it potentially got in through our system that way. So on slide 4, I'm just going to quickly talk about how it's diagnosed. So there's multiple ways. There's nucleic acid tests, serological diagnosis, and chest x-rays. You don't really need to know much about this, but I just thought it'd be interesting if ever one of you contracts it, what might the testing be involved, the testing that might be involved, and also that you have a better idea about this virus. So nucleic acid test, this just means that when someone will take a mouth swab, they'll extract the genetic material from that mouth swab and then check if it has any of the coronavirus genetic material to see if the person is infected with the virus. The serological diagnosis is looking at components within a patient's serum fluid, so within blood and other fluids, to see if there are any markers for the coronavirus. And there's also chest x-rays which can be performed to see if the lungs have been affected in any way. Okay, so moving on to slide 5, how does the coronavirus actually get into cells? So I thought I'd add this in here because a lot of people are saying, oh, you get infected with coronavirus, but I think it's interesting to know how it actually causes diseases and why it's specifically affecting cells within the respiratory tract. So first of all, what we need to understand is that coronaviruses, they need to attach themselves to cells, and they do this using a spike protein. So this is just a component on the virus which is used to attach itself to human cells. Coronavirus COVID-19, so the one that came out in December 2019, the one we're currently experiencing, has a particularly sticky spike protein, which allows it to infect cells better and spread faster than other coronaviruses. So once the coronavirus has attached itself to our cells using its spike protein, it docks itself to receptors on the cell. So these receptors are basically just, you could visualize them as like a port, and the virus is a boat and it's coming into the port and it's docking there. And coronaviruses particularly like to use a receptor on our cell known as angiotensin converting enzyme 2. Otherwise abbreviated to ACE2. So what this means is it's just a place where the virus docks into, and this place is called ACE2, and that's how it gets into the cell. So it's attached to the receptor, and then it uses proteins to cleave the virus's membrane, and then it fuses with the cell membrane, and then that fusion of the virus and our cells allows the virus's genetic material to go inside the cell and start replication. And once that virus is within the cell and started replicating, then that will lead to cell death. So you can see that here in the image at the bottom of slide 5, you've got the SARS-CoV-2 virus and it's fusing with the cell membrane. And once that has fused, then the genetic material can pass into the cell, and that's when you get infection. So moving on to slide 6, I'm just going to quickly talk about the pathogenesis. So this means how the virus actually causes disease. So SARS-CoV-2, as I've said, docks onto cells at the ACE2 receptor. So just to visualize it as the port, a boat port being called ACE2, and the virus is a boat and it's coming into the port and it's docking there. And this ACE2 receptor is more common on cells within the respiratory tract, such as the nasal mucosa, the bronchus, the lungs. It's also been found in the heart, esophagus, kidney, stomach, bladder, and ileum, and also in testicular cells, which is currently raising some concerns about fertility in young patients, but that's yet to be confirmed yet. So the virus basically docks itself onto cells which express this ACE2 receptor, and those cells which have this receptor are more common in the respiratory tract. So once these viruses get into the cells, they basically cause the cells to die. So the viral replication will ensure that all the cells that it has replicated in die. And when that happens, you get this vascular leakage and cytokine storm. So what is this? Essentially, when the cell dies, it releases loads and loads of molecules or components which are really inflammatory. And these inflammatory components are known as cytokines. So we call it a cytokine storm. So you can just imagine this environment where loads of cells are dying because of the virus and loads of inflammatory molecules are being released. And what that does is that will cause inflammation, and that's what leads to some of the symptoms, which leads to, for instance, mucus production and coughing and difficulty breathing. Just for some extra information, there's also some evidence to show that CD4 and CD8 T cells, which are just two types of immune cells, so just two types of cells which are part of the immune system, these cells have been shown to be hyperactive in patients with severe COVID-19 infection. And what this means is that these cells are trying to attack the virus so much, but they're also becoming hyperactive. And that means that they're also releasing loads of inflammatory cytokines, loads of inflammatory molecules. So what happens when all of this cell death occurs and all of these inflammatory molecules are being released? Well, as I said, you get some mucus production, which leads to difficulty breathing. And it can also lead to acute respiratory distress syndrome, abbreviated to RADS. And this is what prevents oxygen getting into the lungs and prevents breathing. So just to summarize here, essentially, you've got the virus which goes into our cells within the respiratory tract. It replicates itself, and during viral replication, it kills the cells. When the cells are killed, you get a really big inflammatory environment, which then leads to the symptoms of disease, such as mucus production, which prevents you from breathing properly, and you get coughing, and that's also what causes you to get fever. Okay, so moving on to slide 7, which is vaccine development. So this is a good news slide. So we've just heard all of the rather scary stuff about COVID-19, but there is some good news. So as I said in a previous slide, we do know a lot about this virus already. We've already sequenced its whole genome, so we know a lot about the virus. And because we've already experienced previous infection from other coronaviruses, we already have a lot of information about this virus. So there are several ways we can stop the virus. You can either block it from entering our cells, and we can do this using antibodies. You can also enhance our immune response to fight the viral infection, and we can do this using type 1 interferons and convalescent plasma. And you can also block viral replication within cells, and you can do this using ribavirin and other antiviral components. So what are all these things? What are antibodies? So antibodies are small proteins which are produced by a type of immune cell known as a B cell. And so antibodies bind to anything that's foreign, any foreign substance that invades the body, such as COVID-19, and they neutralize it. So they're these little molecules which are sent out from B cells within our immune system, and they go and attack anything foreign and stop it from working. So we can try and develop these, make synthetic versions of these antibodies, and hopefully inject them into a person and prevent that person from getting COVID-19. You can also use antiviral cytokines, so for instance, type 1 interferons, And these are just a type of inflammatory molecule which you can inject into a person, and they are used to impair virus function. We produce these naturally in our body, but we can sort of make more of these components and then use them to make a vaccine to impair virus function. We can also use antiviral compounds such as ribavirin. So ribavirin is just a compound, a molecule. We don't need to know much about it other than the fact that it can modulate our immune system, so it can help us fight the virus better, and it can also inhibit RNA polymerase. So what is RNA polymerase? This is an enzyme which is used to help viral replication. So when the virus is in the cell and wants to replicate its genetic material, it will use RNA polymerase to help it replicate its genetic material. So ribavirin inhibits, so it stops this RNA polymerase. So if we can make a vaccine using this and inject it into someone, then hopefully that will inhibit the virus from replicating its genetic material. We can also use convalescent plasma, and this comes back to the idea of antibodies. So when someone has been infected with COVID-19, they would have raised their own antibodies against the virus. So what we can do is we can take the serum fluid, so the blood of someone who has already experienced COVID-19. We can extract their antibodies, which we know are already specific to COVID-19, which will help neutralize and stop the virus. We can take out these antibodies from this serum from a patient and then put them into a new patient who is currently undergoing the infection. And hopefully those antibodies will help reduce the viral infection in that person. So it's a bit of a complicated process, but essentially you're taking someone's blood and putting it into someone else, and hopefully the antibodies in that blood will help the next person to fight the virus. There's also something new which has just popped up recently in the news, and that's the idea of creating a decoy ACE2. So if you remember in a previous slide, I talked about the ACE2 receptor, and this is the sort of portway which the virus uses to get into our cells. So we're thinking of creating a decoy ACE2, which would stop the virus from getting into our cells, and rather it would go to the decoy ACE2 and it would bind to that instead of going into our cells. So actually this is so recent that the paper is not even on the journal site yet, it's only in manuscript format, so it's very recent data, but it could prove a significant vaccine option. Okay, so moving on to slide 8, what do you need to know to protect yourself? So most of these things you would have heard about before, but I'm just going to quickly run through them so that it's more clarified in your mind. So how is it transmitted? It's normally between two people in close contact within 2 meters. So keep up with the social distancing, that will definitely help. And it's also passed through respiratory droplets, which we know. So wearing a mask can definitely help. The incubation period for this disease is between 1 and 14 days, although the average is 5 days. So if you think anything is contaminated at all from doing any shopping, if you can leave it for 5 days, then that would be best. And then after 5 days, wash it thoroughly and then use it. If you can't leave it for 5 days, then even leaving it for 1 or 2 will definitely reduce the risks. And then of course, washing everything thoroughly and washing your hands for at least 20 seconds with soap. And if you're using hand sanitizer, use hand sanitizer which has at least 60% alcohol in it. It can last for a few hours to a few days on surfaces. So again, try not to use anything for several days if you can. The safety measures which you can do to help yourself is to clean your hands as often as possible, avoid close contact, cover your mouth and nose, and then when it comes to face masks, try and change these as much as possible, but also make sure there's no rips and tears in them. And of course, cover coughs and sneezes. Although if you are coughing and you have other symptoms such as fever and tiredness, then it's worth either looking up further information on the NHS website or calling 111. That's for the UK specifically. There are some less common symptoms such as aches and pains. So maybe look out for these other ones as well, such as nasal congestion, runny nose, sore throat and diarrhea. But the good thing to note here is that about 80% of patients recover without any need of special treatment. And it's only really 1 in 6 that become seriously ill and develop difficulty breathing. And these patients are mainly those that are a bit older and those with predisposed conditions and people that already have health conditions, so perhaps high blood pressure, heart problems or diabetes. So that's it from me. If you'd like any more information on this, there's some great resources on the CDC website. Just type in CDC website on Google, and the WHO website, which is the World Health Organization. They have some great fact sheets as well, which are very insightful. Otherwise, you can email Oonagh and I with any questions if you have any. And now I'm going to pass on to Oonagh.
Thank you for that, Lottie. That was very informative. So yes, just to say, I mean, one of the main purposes of this webinar and for you guys watching the recording in the future was just to provide some kind of generalized advice that's based on actual science, because I know that some of you have been in contact with me asking me about this thing or that thing and should you do this or that. So what we really wanted to kind of transmit or share today, it wasn't to kind of freak you out or to fearmonger or anything like that, but we just wanted to kind of provide some facts about where we're actually at with the virus. And then I'm going to talk about a little bit what you could be doing to keep yourself healthy, and just kind of busting a few myths that have been floating around on the internet, essentially. So the first thing, and probably if some of you have worked with me before, you know that I pretty much say this to anyone who comes to see me, children or otherwise, is the concept of eating the rainbow. So what does that mean? So eating the rainbow essentially means eating lots of different colored foods. And I'm not talking about Smarties, guys. I'm talking about actual fruit and vegetables. And so within that, so I think you can probably see the image here, which is not my image, by the way. It's something I got from a lovely website called Lifehacker, which I will link in the description box below. But essentially, it's about eating different colors, and why you should eat different colors is because each of these colors has its own specific nutrient quality and also minerals, and also may be beneficial for different parts of the body. So if I can bring your attention to the red section, for example, you can see that there are A and C. So those are vitamin A and vitamin C. And then you have even smaller, I'm not sure if you'll be able to see this, but there's brain and lungs. So these particular colored foods are also good for benefiting the brain function and lungs. So just to kind of bring your mind to that. And if you can take a look at all these images, so I will link this image in the description box so you can check it out for yourself. You can see that, for example, there are lots of different fruits and vegetables, and some of them might be local to where you are from. So if you're from Ireland, for example, things like kale and leeks and cabbage are probably quite easy to get and can be grown locally. Whereas things like papayas might be more difficult to source. And something I wanted to draw your attention to here as well is the concept of bioavailability. And in very, very simple terms, essentially what bioavailability means is is the actual amount of the nutrient that is available within the food for you to absorb. And something that affects bioavailability is the quality of the food itself. And if the food has been, and in a lot of cases, for example, foods that are picked in Peru and India and other countries and then are imported to Europe and the UK and Ireland, they're picked before they're ripe, and then they're ripened in some kind of artificial way, or they might even just be sitting in a boat or a plane or something. And essentially what has happened is they're losing a lot of their nutritional value in the process of journeying. And if you sometimes go to the supermarket, you might buy something that's essentially 3 or 4 weeks old. And during that time, it's losing a lot of its nutritional value. So not only should you be looking at the different colors, but also be looking at trying to get the best quality that you can. And a really basic way and cheap way to do this is by buying things that are actually grown locally to where you live. So, you know, if you live in Ireland, things like leeks, cabbage, kale, lettuce, apples, tomatoes, strawberries, all of these things can be grown quite locally. Carrots, pumpkins, potatoes, but maybe things like figs might not be able to be grown in Ireland, but you're better off getting figs from France than you are from maybe somewhere in Africa. If that's further away, you know, sometimes I think you can buy figs from Northern Africa as well. So when you're in the supermarket, or if you're in a local vegetable market, wherever you buy your food, it's good to see how far it's come. So not just from an environmental perspective, which is a whole other webinar, which I could do, but from a health perspective as well, it's important. So the next thing I wanted to talk about is I've noticed a lot of social media posts about, you know, what we should be doing to stay healthy and protect ourselves from the virus is to eat lots of salad and lots of raw things. So normally speaking, it's great if you can eat lots and lots of different colored things, as I said before. But at the moment, it might be more prudent to eat hot things rather than cold things, if you can, if that's possible for you. And the reason being is because from what we know so far, the coronavirus can live. So I think Lottie mentioned this before, the coronavirus can actually live on the surfaces of certain things for up to several days. So if that's the case of food, so one thing you could do is just leave your food for several days, but maybe with some food products that wouldn't work out so well. So a really, really easy way you can do is just make instead of making a salad, maybe use what you would have made for a salad into a soup. So if you're thinking of having a spinach salad, you could instead have cooked spinach or spinach soup, just a basic example, or raw peas. You could have cooked pea soup instead. And just do that for a while. That's because the coronavirus, as I said, if it's above a certain temperature, it actually dies, it can't survive. So it's just a really sure, fast way of doing it. If you're still like, okay, you know, I can't give up my salad, that's okay as well. So I don't want to completely freak you all out and say you have to manically cook absolutely everything. It's just a kind of suggestion of what you could be doing. And another thing you could be doing, which was suggested by a colleague of mine, is to just really thoroughly wash your produce when it gets home. So she's actually from Morocco, and she said when people who live there, they actually wash their food in a little bit of lemon juice or a little bit of vinegar or some iodine or some potassium. So they have different kinds of things that you can clean, and this is quite common in many countries that don't have clean sanitation. So that's another way that you can still have cold things. But if you want to just keep it simple, just cook your food, essentially. And then one other thing I wanted to add is I actually gave a whole workshop on this a couple of weeks ago with my mother, who we actually worked together at Roaring Health Centre, but it was about antiviral foods and how to prepare them. So if you're interested in watching that full video, I will link it in the description box below. But just as a very, very quick kind of overview now, there are a few foods that have been researched quite thoroughly over the last 30 years that have shown to work and have what's called an antiviral effect, which means to maybe prevent or reduce the kind of outbreak of the infection within your body. So to either block it or reduce the outbreak of it in your body. And these foods have been tested for influenza type viruses. So they haven't actually been tested against corona. So a little disclaimer here, I'm not claiming that these foods will cure corona, okay? But they have been researched in relation to influenza type viruses. So these foods are, for example, rosemary, lemon balm, ginger, sage, thyme, fennel, pears, peppermint, basil, dandelion root, and garlic. And these foods, if you want to know how to actually incorporate them in your food, I do encourage you to go ahead and watch the other video. But just a little side note on garlic is that the reason why people are raving about garlic on the internet is because of a particular compound within garlic called allicin. And it is actually the allicin that has this all these antiviral, digestive helping, health promoting effects. So if you want to get the health benefits out of the garlic, you need to chop it into small pieces or slice it and leave it exposed to the air for 5 to 10 minutes. And the oxygen combined with the cut garlic will actually release the allicin so that it's bioavailable for you to actually absorb. Because if you don't do that, then the allicin will not be bioavailable. Okay, so another thing I wanted to talk about today is some people I've seen posting on social media and things like that, saying that, you know, this is a perfect time to get fit and get healthy and maybe go on a diet and lose loads of weight or get really, really fit. And of course, you know, as a healthcare practitioner, I advocate, you know, exercise and, you know, eating a healthy, balanced diet and all of these things. However, what I do not recommend is just absolutely changing everything you're doing and going on a really restricted diet on your own, or suddenly going from zero exercise to working out 4 hours a day to try and achieve some kind of unrealistic goal. And the reason being is because more often than not, you're likely harming yourself rather than getting the benefits you're looking out of it. So what you really don't want right now is to get some kind of sports injury that you have to go to the hospital or, you know, go on a diet and then you end up getting sick because you're not eating enough nutrients or because you're reducing your calories too much. Because you do need to have energy to deal with the stress of what you're experiencing. And I will be talking a little bit about that in a moment when we get to the anxiety. But I do recommend, obviously, eat a varied whole foods diet. But if you're going to make huge drastic changes or think that that's something you should do, I strongly, strongly recommend that you seek professional help from a healthcare professional who's specialized in that area and don't just go off and do things on your own without any guidance. So we'll move on to the favorite part, my favorite part of this presentation, which is how you can manage anxiety and stress during this period. So this first slide here, you can see there is a lovely astronaut who's floating away in space. And I picked this image because it seems like he's going off into the unknown. And that's what I wanted to talk about first. So the first thing, and this is really, really important, is to just recognize that what you're experiencing right now is completely uncharted territory. You've never experienced anything like this before. I mean, the whole world has shut down, essentially. And this is something that we're all coming to terms with, and it may have affected our lives in a variety of different ways. So I won't get into the different ways it could have affected our lives. But essentially, in some way or another, this pandemic has affected your life. And it's really important to allow some time and some space for you to take stock of how you really feel in this moment and just connect with that. And it might be difficult because we might be scared, we might be anxious, we might be grieving, we might be feeling like we've lost something. It might be a person or all of our money or whatever it is. But it's really important that we actually connect with what we're feeling and we allow that feeling to come. Because if we try and suppress that feeling, it's just going to sit there and rot. It's not going to disappear. And the longer you leave it, the harder it's going to be to overcome whatever thing you need to come. And it's going to be holding you back from picking yourself up and reaching your full potential and seeing maybe what the benefits could be out of this situation. So the second tip that I wanted to share with you today is a really important way of managing anxiety is to actually have some kind of order in your life. So what most of us were probably used to before is having maybe a clear schedule, whether you're a student or you're a working professional. You might have had a 9-to-5 schedule, or maybe if you were a stay-at-home mom, there might have been a schedule within that where your children were away at school, or maybe you were homeschooling then. But regardless of what you were doing before, you probably had some kind of system in place of how you did things in your day. And that has probably significantly changed because we can't really go outside for the most part. We can't go to the gym. There are many things that we might have been doing before, like meet up with our friends, that we can't do. So in absence of an external structure, we must create an internal structure. So how do we do this? I will get to that in the next number of slides, but just wanted to reiterate a very important point is within that plan, you must include self-care. So it's not about making some kind of really intense, rigid plan that's 18 hours a day and that involves 4 hours sleep, okay? And it's achieving every single thing that you've kind of been beating yourself up about not doing for the last 10 years. It's about finding structure and finding your space within yourself. And within that, you need to include self-care. This is very important. Self-care is as important as whatever deadline you need to meet for work or school. And the third point, so just to say it for the 100th time, is to not overdo it and to allow space within your schedule. So as I said just now, you know, it's really important that within your schedule, you allow regular breaks, regular rest times, space. You know, if you're inside an apartment and you can't actually go out into nature, at least go out your front door and take a few breaths of air, or open a window and take a few breaths of air. Whatever level of connection with the outside you can have at the moment, it's important to do that on a regular basis. So how do we make a plan that we actually stick to? So I've just compiled a couple of tips here. And just to say, you know, these are just some very kind of general guidelines. So normally speaking, when I do things like this and I work with people one-on-one, I kind of work on an individual basis, and we identify at the beginning how you work as a person and what things will work for you as an individual. But today, because I wanted to make it more general and to reach as many people as possible, these specific things may not connect with you. And just to say, that's completely fine if they don't work for you, because they are general. Okay, but hopefully they do. And if you have any questions, or if you need clarification on anything, or if you think, well, maybe this doesn't make so much sense for me, Oonagh, but do you have an alternative? I'm happy to help with that. You can just send me an email, and I will link my email in the description box below. So how do you make a plan that you actually stick to? So first, be really clear about your goal. What is it that you want to achieve? And it's really important that you identify it in a really clear way. So for example, a very vague goal would be work out more. Okay, but what does more mean? What does work out mean? It's kind of a bit vague. You know, if I said that to you, you would have a concept in your head of what working out more is, but my concept might be different. So a really clear way would be, for example, practice a 5-minute high intensity interval training workshop every day at 8 a.m. for the next 30 days. That's a clear goal. Okay. So yes, the second point is make your action steps really clear and specific. So really clear. What are you doing? A 5-minute high intensity interval training workshop. What exactly? Which video are you going to follow? So maybe you have a video that you're going to do every day. So find the video, be prepared. Don't be there at 8 a.m. in the morning saying, I don't know which video to do. You need to have it prepared beforehand. This 5-minute video. Be really clear and specific. This video at 8 a.m. every day for the next 30 days. And remember your why and educate yourself. So, I mean, as I work with many people who have anxiety, usually the why revolves around something to do with stress management or anxiety. So maybe your why in this scenario would be you feel that maybe getting a little bit more energy and movement in your day will benefit your mental health, and maybe it might help you to bring blood to your brain and give yourself an energy boost in the morning before starting your working day. So that's your why, and always remind yourself why you're doing something, because if you don't know and you're just mindlessly jumping up and down doing a HIIT workout, you're very unlikely to stick to that goal long term. So the next point is to think about how you're actually going to achieve these goals. So this comes back to what I was saying before about having realistic goals and actually sticking to them. So if you set a goal for yourself that's completely out of your reach, so it might be at the moment you say, okay, I'm going to go to the gym for 2 hours every day, but the reality is the gym is closed and you can't go to the gym, and then as a result you're going to go, okay, well, I can't go to the gym, so I just throw all my goals out the window because it's over and I failed. But you know, think about how you're going to achieve them. So maybe your previous goal was that you worked out for 30 minutes 3 times a week at your local gym. So instead, you need to work out for 30 minutes 3 times a week, maybe even at the same time, but at home, and to adapt accordingly. So don't forget to think about your personal situation. So this is essentially the same point, but don't forget to think about your current environment. So maybe you're at home and you're stuck in one room with your whole family, so going jogging in your living room isn't something that's going to work for you, or doing all kinds of crazy jumping around workouts isn't going to work. Maybe something a little bit less, you know, if you're in a top floor apartment, maybe you can't be jumping up and down, but you can do a workout that's a little bit more connected to you and your environment. I hope that makes sense. So finally, this final 2 points. So the final 2 advice I'd like to give you. So firstly, to have a journal. So I usually basically get all my clients to write a health journal regardless of their goals, because I think it is a wonderful, wonderful way for you to actually see how far you've come. You know, a lot of the time I notice with people is that they go away and then they do a few things and they come back and I say, hey, you know, how have you been getting on with this goal or this goal? And they said, oh, actually, you know, I haven't really done that much. And then it turns up that they're doing 500 times better than they were the last time I saw them. But because they haven't kept track of their progress, they haven't even noticed where they're going. They haven't actually noticed what an amazing progress they've done. And then they might kind of slowly demotivate themselves because they can't see the tangible changes, especially with things like anxiety. You can't actually see a tangible physical change. It's not the same as, say, weight loss or something where you can see a tangible difference in how you look, right? With anxiety, sometimes it might be difficult to assess how we feel, right? So that's why keep a journal. And finally, the very last thing I wanted to say was, if you can, to find someone that I like to call an accountability buddy. And this is essentially someone who you tell what your goal is. So earlier we mentioned about the high intensity interval training video. So you maybe tell your friend Jane, you say, Jane, I've decided to do this every day. Will you be willing to just be someone that's kind of holds me accountable? So this doesn't necessarily mean that they have to call you every morning at 7:55 and say, hey, get on the mat and do your workout. But you might just, you know, ask them to think of you at that time. So maybe, you know, at 8 a.m. Jane is thinking of me, you know, and she's thinking that I'm doing my workout, and that just helps you to get out there. So in the beginning, that might be helpful. And the other thing is, if you do feel lost, or you do feel you need support, or you feel like you're struggling, it's really important to get support either from your family, from your friends, or from a professional who specializes in whatever goal you're hoping to achieve. So I just wanted to say that there, you know, don't just struggle on your own. There are so many amazing practitioners out there who have so much experience and skill that they can offer to you. So I highly recommend that you look them up. So that was everything from me for this presentation. So I just wanted to say here as well, as this is a recorded session, so we did have a live Q&A, but I haven't put this in the video for anonymity's sake. But if you have any questions at all about the material that we've covered today, please don't hesitate to contact us and we're happy to answer your question. And I've linked my email and Charlotte's email in the description box below, so feel free to get in contact. Even if the question seems silly, don't worry, we're really happy to help. So I hope you enjoyed this video today. And if you have any requests about future content also, feel free to contact